So here we are. So welcome to community. When you think of community nursing, what do you guys think of? What's community nursing? What do you do in community nursing?
Like public nursing, looking out for like communicable diseases within the community and like vaccines and stuff like that.
Yeah. Great.
Prevention and promotion.
Pardon me?
Prevention and promotion.
Yep. Yep. Okay. What else? What kind of roles might the nurse have as a community health nurse? There's a lot. What kind of roles might the nurse do?
Teaching.
Okay, let me clarify that. What kind, for example, what kind of community nurses might you have? I'll start. I was a school nurse. A school nurse is considered a community nurse. What other kinds of community nurses are there?
I always think about the ones at the health department.
Public health nurse. Public health nurse is a community nurse.
Home health.
What?
Home health.
Home health is a community nurse. How about hospice nurse? She a community nurse? He or she? What about occupational health nurse? Is she a community nurse? He or she? What about a faith-based nurse? Parish nurse? Is she a community nurse?
Yes.
Yeah. So lots of different roles. Lots of different roles. Community nursing is a broad general term. Okay, lots of roles we play. We're the case manager, we're the health educator, we're the quality improvement nurse, we might be the vaccination nurse, right? Lots of different roles we can play. So before we get started, I just really, I want you to try and take a step back and just enjoy this class. This is much different from your other classes, okay? Where you have clinicals attached, peds, med-surg, OB, okay? We're gonna wander in the community, into the community in this class. Okay, community, if you think about it, is part of the nursing process, right? You go from hospital admissions, when patients or clients are ready to go home, who transitions them to home? The community nurse, right? Community nurse plays a huge part in the nursing process. Okay. So I really want you to sit back and try and enjoy this course. Try and look at it with you're out in the community, pretend you're in your own community, for a couple of months, let's pretend that you are training to be the community nurse in your own community and think of all the things you're going to need to know to be a successful community nurse in your own community where you live. Okay. So many of you have never even heard of community nursing. Or haven't worked in that area. I have a lot of students that work in nursing homes or assisted living, which is great. That's out in the community and doing community nursing. So that's good. But there's a lot of students who have never been exposed to community nursing. And so I really, it's a 2-credit class. I get it. It's not attached to a clinical. I get it. But number one, you need to pass this class to move on, right? You guys are in your 7th semester, correct? Of 8. Right? Yes, no, yes. So you know the drills, you know the grading, you know the attendance, you know how to succeed, you know how to multitask, you know your time management. This is a heavy term. Okay, you've got to carve out some time during the week, pick a time, carve some time to do your community work. Then the rest of the time you can focus on your med-surg and peds, but you've got to carve out some time. Okay, it does require effort. Okay, it requires the effort of a 2-credit class. The class has been developed with the national curriculum standards of 2 credits. Okay, so the workload is not as large as the upper credit classes. Okay, and we didn't develop the curriculum. It's a national standard. So the hours that we anticipate are expected to complete this class are for 2 credits. Okay, so I'm kind of down to it after 5 terms. This is my 6th term. So after experiencing 5 terms before, here's my down and dirty advice. Okay, you can't blow off this class. Okay, you just can't. Okay, so find a block of time to just review the PowerPoints, get your work done, turn it in, and then you're done for the week with the community. Okay, because if you fall behind with the first exam, you're playing catch up the whole term, because we have no quizzes, right? We have 3 exams, week 3, 6, 9. Okay, and then we have a Hesi. All those 4 are worth 20%. So 20, 40, 60, 80. So you only have 3 key graded assessments during the term, and then your Hesi. They all count for the same, 20% each. And you guys all know the rule about homework, right? All the other, and we'll go through this in the syllabus, all the other work in the class is worth 20%. We'll go through that specifically. And when does that, I'm actually quizzing you guys now. When does the homework get added in? If what?
You're at a 78.
Right. Right. So you have to have a 78 after the 4 key graded assessments for homework to be added in. So let's say after 3 graded assessments, 4, after your Hesi, you have an 80%. Okay. And then we add in the homework grade, and you didn't complete a couple of Nclexes, or you didn't do something. And what possibly can happen?
You're going to fail.
Right. Don't be one of those students in your 7th term. Okay. Don't be one of those students. Okay. There is 2 credits worth of work to do in this class. Okay. I am super easy to work with, super easy, super flexible. My one huge requirement is just communication. Okay. Just communicate with me what's going on, please. If you need an extension, if you are going to turn in something late, I can't fudge on the 1 week. Okay. You do have 1 week to turn things in, but after that, I don't have any wiggle room. Okay. That is a company policy, a school policy now. But all I ask is that you communicate with me. I'm an over communicator, as you can see with all my new announcements, which I'll explain in a minute, but I'm super easy to work with. I really am. I consider this a joint effort. I do my part, teaching you what you guys need to know. You do your part by coming to class for 2 hours a week, completing the work that needs to be done. And then we'll get over the finish line together. Okay. Nobody needs to fail this class. Okay. There's no reason for it. Okay. If you put the effort into it, you'll be fine, but you got to give the effort. Okay. So that's my beginning mantra. Does anybody have any questions? This is a cool, I think it's cool. I know I'm biased, but it's just learning different types of nursing. Community nursing's hard. You know, you play lots of roles. You bring all your skills into community nursing, right? You've taken care of clients across the entire lifespan. You may be doing well baby checks, right? You may be doing adolescent teaching for drugs, hand washing, drug addiction, suicide. You may be working with vulnerable, homeless populations, vulnerable populations, maybe working with the elderly, maybe working with a congregation, maybe working in work settings in occupational nursing. Everything comes into play with community. Your med-surg skills, your pediatric skills, your maternity, your OB skills. You may be working with teen pregnant moms. So everything comes full circle in community. It takes all your previous skills, foundations, pharmacology, peds, OB, everything, mental health, everything comes into community. So just sit back and relax and, enjoy all learning about, you may end up being in the community as a community nurse. But the feedback I get at the end is, everybody that was like, oh, ho hum at the beginning, we got to take community. At the end, they're like, this is actually pretty cool, learning about all different roles that the community nurse does. Okay. So that's my spiel. Feedback, comments. So we all like rah, 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 rah community. Yay. We'll be fine. We'll be fine. We'll get through this together as a group. Okay. All right. So if you just came from peds, then did everybody just come from peds? Where, hang on. I have to figure out how to pronounce this. Waleed, could you turn your camera on, please? Thank you. Thank you. Got to keep your cameras on. Did you guys hear that in peds? Okay. So you guys have already gone through the PowerPoint, right? I'm going to go through it, but I want to see, just raise your hand. Who hasn't gone through the PowerPoint? Probably Anthony. I don't know. Did you just come from peds, Anthony?
Yeah, I came from Pete's.
Okay. So raise your hand if you haven't seen the PowerPoint. Wow. Wow. Awesome. So as you know, with every class, since this is your 7th term, as you know, we're required to go through the PowerPoint. Okay. I'm going to kind of skip through it because I've already seen it, but I'm required to go through it. Okay. Questions before we get started? Any burning questions? I can't wait. You guys might get a little bit more of the gift of time, having gone through this already, and everybody looks kind of tired. Natasha, what's so funny? You're tired.
Yeah, I'm like, that's the same thought I have. I'm like, we look exhausted.
You guys look tired.
But we'll
Yeah,
be
you
fine.
guys-
We'll be fine.
Okay, all right. We're gonna rally for community on Monday nights, right? Rally cry. Yay, community. Okay, let me share my screen. And the other thing too is those are my 2 grandbabies. That's little Vivian and little Harry. And they don't
Very
live here.
cute.
They live over in the UK. So yeah, that's Vivian and Harry.
They're
And
adorable.
aren't they cute? His big blue eyes. Hang on, I need to refocus. What did I say I was doing? Oh, pulling up the anyway, that's Vivian and Harry, and I'm due to be a grandma for the 3rd time in about 2 weeks. And I'm finally going to have a stateside baby who's going to live right down the street. So super excited about that. Baby Patrick is coming soon. Okay, so where am I at here? So with the couple things I want to cover, we want to cover the PowerPoint. We'll be able to go through it rather quickly. Then I want to cover the syllabus, not the whole, just go through a couple parts of it. And then I want to cover the modules, not all 12 weeks, but at least get going for the first couple of weeks. Okay. And then I promise we will be done when we cover those. Okay. I promise. Okay. So this is nobody's first online learning class, right? So you guys know what online looks like. Okay. As I said in my little intro, I think it's kind of fun to have this community class online. I really do. I know it's on campus as well, but I hear from the students that they really like it in the online setting, and it's not attached to a clinical. All right, so you have required course week. Oh, let me step back real quick. I haven't checked it since early this afternoon, and I'm going to stop sharing. Has anybody not completed the syllabus quiz? Okay, William, who else? Waleed? Okay, whoever hasn't completed it, please do it in the next 24 hours because you don't have access to course material. And that's what the group told me this morning. They have access, everybody has access to the announcements, but nobody has access to the modules. And we're starting, you got work due this week. And we were told by one of the students that it took 2 minutes. 2 minutes, she said, to do the syllabus quiz. 2 minutes. Do you guys agree?
It
Okay.
took me like 30 seconds. It's
Okay. All right. So go in.
not that hard.
Yeah. Go in and do that so you can get access. Okay. The technology, the literacy quiz, I don't think that's not tied to getting access to the class material, but just go ahead and do it anyway. How long did that take you? The
We do it
little-
every single term. Every single term. It's the exact same every term. So 2 seconds.
Hey, guys, so for those few of you that didn't do it, go do it. You know, how about with the gift of time that I'm going to give you at the end here tonight? Please promise me you'll go and do it. Okay, so you have access to the material then. Okay, so okay. Okay, let's go to, okay, you guys know this, right? You know the chain of command, right? If you have issues, who do you start with?
You.
Me. Okay, if I can't solve it, here's the bottom part of this is a good place to save this slide. Okay, because it has our course lead for community, who is Dr. Lundy. Has our information there. And then it has our National Dean of Online, who is Dr. Brown. Okay, so the chain of command is me. If I can't help you, I will get with my course lead, Dr. Lundy. If we can't help you, we will get Dean Brown involved. Okay, so that's the course, that's the chain. So start with me, and then just to be aware, you guys are far enough in the program that you know about the whole section of student resources, right? In student resources, you have anything and everything. Help with Hesi, help with Kaplan, help with Nclex, help with IT. So if you're asking me basic questions in an email, that's fine. But don't be surprised if I redirect you back to your student resources. Okay, because at this point, you guys should be able to problem solve what's in your student, what questions. There may be questions you can't, but for the basic common, like how do I access Nclex? Or how do I access this? Or how do I submit this? Everything's in there. Okay, everything's either in the module or the announcement. I'm pretty communicative as far as announcements. I use the announcements as like my daily newsletter. So when you go in to the class, check the announcements. Do you guys get, I think you guys get, do you guys get notified when I post an announcement? Yeah, okay. I would go look at your announcements every couple of days, and we'll go through the ones I've already sent. Okay. Obviously, I'm your first point of contact. I'm available by email, messaging, and phone. I don't care if you text me. I don't care. Just identify yourself, because I won't recognize the number. I pride myself on prompt response times to both email, Canvas messaging, and phone. Okay, texting. I will get back to you quick. I mean, I know they say within 24 or 36 hours, I will get back to you as soon as I can. And that's usually pretty prompt. Okay, I'm available for one-on-one Zoom meetings anytime. Just need a little bit of notice. I teach obviously this class. I teach earlier in the day on Mondays. I teach from 1 to 3 and then 8 to 10. That's my schedule. Then I teach on Tuesday mornings from 9 to 11, all Eastern times. Okay, so so if you can't make a class, and I'm just kind of ad-libbing now, if you can't make a class, it needs to be for a good reason, because you're expected to attend this class. But if there's a conflict with a few clinicals, or there's an emergency or something, I really want you to try and attend live classes. So I'll offer you to come to my other 2 sections, Monday afternoon or Tuesday morning. Okay, hopefully you can do that. So, but you are expected to attend this particular class. But again, I'm flexible. I will work with you to the extent that I can. Okay, but you got to communicate with me. What is my role? Well, I can suggest ways you can improve your performance in online courses. I give you feedback. I pride myself on giving pretty good feedback, or the best feedback I can on your graded assignments. I can, if I'm an early grader, I like to grade things early. If you turn things in early, I try and grade throughout the day during the week. So if something's in and it was due Sunday and doesn't require any further follow-up, I'll grade it. Let's say you turn in Nclex on a Wednesday or Thursday and you only have a 39. Anything below 40, I'm going to send you a message back that says, I've reopened Nclex for you if you'd like to retake it. Because I'd rather not have you submit a 39. I'd rather have you submit a 50, because that means that you went back and reviewed everything and reviewed the rationales. So it's more for learning purposes. Does that make sense? If you're scoring in the 30s, you probably didn't get a lot out of it. So I want to give you another chance to resubmit it before Sunday. Okay. So I'll reopen it for you, but I'll send you an email about that. Okay. Hey, you got a 38. If you want to reopen it, I've opened it for you. Turn it in by Sunday. All right. On the discussion questions, I know your initial post is due on Wednesday. I'll grade those when the peer responses are in there. Okay. I'm not going to go back and grade those twice. So by Friday, if you've turned in your discussion, your initial response on Wednesday, and then did your 2 peer reviews by Thursday or Friday, hopefully I'll start grading those over the weekend. So I like to grade early. You got to be careful though. And this will come up in one of these slides. Be careful about working ahead. And I'll tell you why in a minute, because this is a slide. Online courses, professional setting, communication, respectful at all times. I've never had an issue, ever. You guys know when we start and stop. Right? You guys know about discussion posts, initial one due on Wednesday. Late policy. Okay, without looking at this, what's late work policy? Without looking at this, what is it? Number one, you have to communicate with me prior approval. And I'm kind of a stickler for this because all I ask is honest and updated communication. Okay. So I'm kind of a stickler for this. So prior approval. So if you're going to be late turning in your professional development plan that's due this Sunday, and you're going to be late, you need an extra day, that's fine. If that's what you choose. But number one, you have to let me know. Number two, you have to understand that if it's late, it will have a 10% deduction. Okay. If there are emergencies and they're documented and paperwork's provided, we can work with that. I will definitely work with it. But if you just, I like to go in on Monday mornings and see who hasn't turned in what was due on Sunday. And then I'll send out reminder emails. Okay, that you'll have the rest of the today to turn it in, or the rest of the week with a 10% deduction, but you didn't, if I don't have any emails, let's say 5 people don't turn in their professional development plan, I don't have any emails, then it's a 0. Okay, so I don't want to go there. I really don't. That's not what I want to be. I want to be teaching you guys about community. I don't want to be dealing with that. Okay, and you're in your 7th term. Okay, you shouldn't be doing that. Okay, here's about working ahead. There has to be 2 submissions each week to count for attendance. Okay, one is attending live lecture and doing the attestation. Okay, what I like to do, and I started this last term, so this maybe is I think this is my 3rd term doing this. I like to take the last 10 minutes of class and do the attestation together as a group. That way you get it done. It's done. Okay, we answer the 2 questions. We all help each other. We all write in the same answers. Doesn't matter. It's great. Then we hit submit. That's one thing you don't have to worry about. Oh, because you have to do the attestation within 24 hours. So if somebody forgets, if we do this tonight and somebody forgets to hit submit, it has to be in by tomorrow night. Otherwise, you don't get credit for attendance and you attended class. That's why I try and do it at the end of class so we can all get it done and you don't have to worry about it. Make sense? Be careful about working ahead because we need 2 submissions. So like this week we have live lecture and professional development plan, right? So that's 2, right? We don't have a 3rd one, and you can't go, you're not turning anything early because it's week 1. So that's not a good example. So next week we have attestation, a discussion question, and an Nclex. So we have 3. So you could potentially turn in one of those early, right? So a lot of people like to do their Nclexes early. That's fine. But be careful. Make sure that the weeks you're turning in ahead of time, you have 2 other submissions. Is this the way the PEDS instructor explain this to you? Okay, does that make sense? And be careful, because there's a couple of weeks that there are only two, I think week 1 and I think it's week 8. I don't know. We'll have to double check. Only have 2 submissions possible. All right. So what I tell students that want to work ahead for Nclex is go ahead and do all your Nclexes. That's fine, but don't submit them until the week they're due. Okay. And then here's all the opportunities for submissions in this class: Nclex, case studies, projects, papers, Kaplan. We don't have any quizzes. There's no quizzes in this class. 3 exams and a Hesi. Okay, and then you guys know about the 14-day, right? If you haven't logged on, posted attendance in 14 days, you'll be dropped. Not documented, not done. Okay, that goes for, this is in the orientation PowerPoint, and it goes for class, but this is also pretty universal with nursing. Would you agree? Not documented, not done. Okay, this is a new slide, and this is being enforced this semester, this term. Okay, it's always been enforced, but in different ways. Okay, so this is something that I don't know if your PEDS instructor pulled this out and went through it with you, but I need to go through it with you. Okay, cameras must be on at all times when you're in class. Okay. This is a no-brainer. You're not allowed to be in class if you're driving. Safety first. Okay, so you can't tell me, and this is not my rule, this is the university's rule. You can't tell me that, you know, you're almost home from picking up your kids from school. You'll be done home in 10 minutes. It's not gonna fly. Okay, there can be nobody in their cars, even pulled over. Okay, you're not allowed to be logged in while you're at work. Okay, this has been an issue. So we put all these in writing this term. Okay, the online class is just like being in a real class. Please plan accordingly. Okay, so if you think that you are going to have an issue with any of these 3, any of them, send me an email. Tell me what the issue is, and we have to sort it out. Okay, had a student from the morning class that has to go to a bus stop and pick up her kid in the middle of class. It's not going to work. It's not going to work. What happens on exam days? It's just not going to work. Okay, so we're offering the student other sections to take where this isn't an issue. So this is being enforced this term. All right, so anybody have any questions about that? Okay, I am assuming that you have gotten this far and you have been this successful by knowing these 7 key steps to success. Okay, so reviewing the work each week, completing the assignments, knowing that this 8 to 10 on Mondays is mandatory, know the rubrics. I can't stress that enough. Look at the rubrics before you turn in an assignment. That's how I grade things. That's how we all grade things. Know the rubrics. Okay, complete your work and then study. Okay, keep in contact with me, have a reliable internet. You guys already know this. Log into class 4 to 5 times a week. Submit all assignments on the week when they are due, including discussions. Early submissions will affect your later attendance and will cause you to miss class. You have to be mindful of that. Okay. You guys know how to get started, right? Yes. Okay, supporting your learning, other learning activities. We do weekly mandatory lectures. We review key complex course concepts. I want this to be interactive. I don't want to, I know you guys are tired, but I don't want to listen to myself talk for 2 hours. I really want you to participate as well. And I ask a lot of questions, and usually I get participation. I hate to call on people. Sometimes I have to, but I really don't want to. I just want this to be interactive. You know what? You're going to get out of this class what you put into it. Okay. So best to be engaged and participatory and prepared. Okay. Please participate in the discussions. right? If you're having technical difficulties logging in, contact technical support. Where do you find technical support's information?
Student resources.
Thank you. Okay, this is a generic slide about weekly review sessions. With regards to community, we do review sessions the weekend prior to each exam. So in the next day or so, I'm going to be sending you out the schedule for all 3 exams. So for example, in week 3, your exam will be Monday night. We do review sessions that weekend. We do 2 on Friday, 1 on Saturday, 1 on Sunday. Okay. And then you'll go and take your exam Monday. Okay. And we know that we try to do Friday, Saturday, and Sundays because we've been told that nobody has classes on Friday. So that's why we're offering 2, Friday, Saturday, Sunday. So you'll have an opportunity to go to 4 different reviews by 4 different instructors. Okay. You'll also get the recordings. All right. We all share our recordings with each other. Okay. So then I'll post I'll post all 4. Okay, so you'll have 4 live review sessions to go to. And I know you've already heard this, but I can tell you that attendance at live review sessions greatly enhances your grade. There's a direct correlation about attending live and not attending live. So I'll send out the schedule, but it will be for you guys, it'll be the end of week 2, going into the weekend, the end of week 5, going into the weekend, and the end of week 8. Okay. And then week 9, we'll talk about when I get there, but in week 10 is the week before Hesi. Week 10, we spend the entire 2-hour live class doing a Hesi review. So in week 10, you have to attend your regularly scheduled lecture, which is tonight, to do the Hesi review with me, but we give you the schedule of all the other sections in the week. So there's 11 other sections. So you have the opportunity to go to more than one Hesi review. You can go to them all week. Make sense? And we do the recordings. You'll have 12 different recordings as well. So week 10 is totally focused on Hesi. And week 11, you take it. Okay, here's what it looks like in our class. Let me make that a little bit bigger. All right, so you got your 3 exams, right? Each worth 20. And then your Hesi worth 20. So they're all worth 20, 20, 20, 20, and 20. And then here's how we break down the other 20% of homework. Okay, this is a big one. It comes up in week, is it 9? It's either 7 or 9, but 8%. We're not going to talk about that now, but what this vulnerable populations assignment is, as we get into the class and you start to learn about vulnerable populations in the community, you're going to pick a vulnerable population within your community. Homeless, HIV, teen pregnancies, elderly. There's a whole list. If you want to, I think it's week 9. If you want to go to week 9 and read about it, so you can start thinking about what vulnerable population we're talking 2 months down the road. Anyway, you pick a vulnerable population in your community and you essentially do a research project. It's a PowerPoint. It's a 10-slide PowerPoint. And you have what you need to do. What are the demographics? What services do they have? What services do they don't have? What do they need? Whatever. Okay. So you can go to the week it's due, and that's where you find the information. But that's what the vulnerable populations is. Simon, this is your professional development plan, which is due this week. It's due Sunday. I'll show you in the announcements. In the very first announcement I sent, which was the welcome, at the very bottom, it had the 2 attachments. Did you guys see those? Okay, I'll show you where they are. There, it's the rubric and the information on the professional development plan. And then I sent you a template to make it easy for you. Okay, and the template is directly based on the rubric. Okay, so that's what, it's not mandatory that you use the template, but you should, because it's what the rubric is. Okay, then we have a case study, which we'll talk about, that starts this week and is due in week 3. And this is a group project. We have 2 group projects. So we'll talk about that. Then we have 4 sets of Nclex questions. I heard this morning from a student that she said there's no link to the Nclex questions Are you guys finding that in your module? Has anybody looked ahead? Okay, while we're on here, somebody, whoever, just a few of you go on there to week 2 and tell me what you see for Nclex and whether there's a link to get to it. Okay, so we have 4 Nclex assignments.
There's not.
There's not. Yeah. Okay. Anyway, I have to work on, I'll tell you the 2 things that the group this afternoon told me to work on. I have to work on an Nclex link that wasn't available. And then the Kahoots that I sent you, I try and send you a Kahoots for every week. The Kahoots that for week 1, it comes in on the end, like the awards. It skips over the whole initial. So I think I have to reset that. I don't know how to do that yet. I need to reach out to one of my teammates. I don't like going over Kahoots in class. I know it's a competitive kind of team game. Sue gets the most points. But for Kahoots, we've developed one for every week. And I just kind of like for you to go through it at your own pace so you can read it, look at the rationales, and take your time on it. Okay? Makes sense? We have 2 case studies, which we'll go through. They're Hesi. I've already uploaded them into the shell. I think one is week 4, and it's hospice one, I think, is the first one. I can't remember which is first. You have a hospice one and a disaster management one. I think one's in week 4, one's in week 7. And then at the end, I think it's week 10, we do a Kaplan. And then we have 4 discussions. And one of those, the last one is a group. The last one is your second group project. And then obviously weekly live sessions. All right. Questions about that? So this all equals from here down, it all equals 20. Okay, weeks 1 through 5, homework grades are turned off. Weeks 6 and 7, your homework grades will be turned on. Why? Why do we turn the homework grades on? Midway through.
To see your grade. Show the impact.
See where we stand.
Okay. And so if you're just kind of humming along, turning in all your work on time, then let's say you have a 78 and I turn on the homework grade and you've been humming along, just turning everything in. Is it going to go up? Is that 78 going to go up? Yeah, because you've turned everything in, right? So it might go up to an 80, 82, 83, depending on what you got. Let's say you have a 78 and you didn't turn in the professional development plan in week 1, you missed an Nclex assignment in week 4, whatever. What's going to happen to your 78? It's going to go up or down? Anyone?
Down.
And then what happens?
You fail.
You're
You're gonna fail a
below.
class. Yeah, I didn't have anybody last term. It was the first term that didn't happen too. So don't let that happen. Okay, don't pass the class with your 4 KGA, your 3 exams in Hesi, and then fail the class by homework. Okay, there's not that much in this class. No reason for it in this class. No reason for it, period. But okay, that's why we turn it on to let you know. And if you're in that kind of trouble, that your homeworks are going to cause you to, maybe a real challenge at the end of the term, I'll already be in touch with you. Okay. Or you should be in touch with me. Okay. And here's that. Here's what I asked you. You already know the answer to this. When does homework apply? When you've reached a 78. Okay. Exams. We all know about ExamSoft. I always ask in week 1 that just go into ExamSoft next week or 2, make sure your ExamSoft account is set up, make sure it's okay, make sure you can sign in. The way exams work with me is I always send you an email on the Saturday morning before the exam and ask you to download it. Okay, so you'll be able to download the exam on the weekend before. And the expectation, right? That the exams are downloaded before you come to class, right? So you can download on Monday. It's fine. It just has to be downloaded before you come to class. All right. And I'm not going to go through the rest of this because you know how ExamSoft works. All I want you to do is go through and make sure your accounts are fine. Okay, I don't want to be running into the problem Monday night with people that say, oh, I can't get on. Go test it first. Okay, make sure nothing happened between last term and this term. All right, anybody who has accommodations, just reach out to me separately with an email. Okay, because just because you had accommodations last term, you know, we have, it's renewable every term. So if you are a student that had accommodations, you got to reach out to me. Okay. Also, if you are a repeat student, okay, or you're just coming back into Fortis, send me an email. All right, because I have kind of a different, with repeat students, I want to keep a closer eye, want to help. I want to help everybody, but with repeat students, I really want to hone in to make sure they're getting it, so that we can pass the class. So please, if you're a repeat student, send me an email. And then I'm going to send you an email back and say, let's schedule a time to meet. Okay. Exams are, you know, this exams are during class time. Exceptions of taking it, other than tonight have to be, you have to reach out to me, and it has to be approved by Dean Brown. They're only for emergencies. All right. So there are exceptions only with written approval by your faculty and copied to the national dean. So you're expected to take the exam at this time. All right. I did have a couple students last term that took advantage of this last bullet. Okay. They wanted to take it on campus. Okay. And that's fine. Exams can only be proctored with a faculty member on campus with 72 hours notice. It must be done during the scheduled class time. So if you prefer to take it on campus and you have an instructor that will stay with you, will do the proctor you from 8 to 10 on a Monday night, that's great. But I do need 72 hours notice before this happens, and don't count the weekends. So you'd have to start working on this like Wednesday or Thursday, because I have to get with that instructor. I have to get her the exam code. I have to get her the troubleshooting number if there was a problem. All right, so it takes some coordination. Claudia raised her hand.
Martha just texted and said that her computer restarted on her. She's trying to get connected to get back in class.
Okay, Martha Day.
Yeah.
Oh, well, she comes up as Martha Ray. I'm gonna get mixed up with that. This term, I can tell you right now, Day May. Okay, here she comes back in. Thanks, Claudia. Okay, anybody have any questions about exam taking? You all know the drill with proctor it. You have to be on camera, show your ID, show your work environment. Don't assume I know your individual requirements. If you tell me in your work setup that this has to stay there because your phone can only stay here, I'm fine with it. Just let me know. Okay. I don't want to be getting in those kind of discussions when we're trying to start the exam. Okay. Missed exams will be held, same as late work policy. Exam, if you miss an exam and you just don't show up, it's a 0. Okay. If you miss it for personal reasons, you can retake it, or you can schedule to take it within 7 days, but there'll be the 10% deduction. Okay. And then if you obviously miss an exam due to an emergency, here's what you need to do. Documentation needs to be within 24 hours. Documentation must be presented before the exam is rescheduled. It has to be rescheduled in 7 days. Otherwise, it's a 0. Okay. Contact me with any issues that may prevent you from being successful on an exam before the exam. I will work with you. I will work with you. You just got to let me know. All right. If you contact me with issues after you've submitted your exam, I can't do anything. It says we, I'll say, I want you to be successful. I will work with you together as a team, and we will be successful. I want you to pass this class and move on to your last semester. Okay. Contact me if you have any problems or you'd like some additional help. Okay. Questions about that section? Okay. Homework. You guys should already be doing this: planning, prioritizing, completing work, and submitting work. You guys, whatever your planning and organizing schedule is, everybody does it their own separate way. I like to do calendars. I like to do phone calendars, everybody has their own way. At this point, you wouldn't have made it this far if you couldn't multitask and time management and working, planning and organizing. Right. So I'm assuming everybody has their own way of doing this. Here's our late, once again, late work, prior approval, number one, 1 to 7 days, 10% off, and after 7 days, 0. And I can't fudge with that. I can be flexible in a lot of different ways, but I can't be flexible with that. Nclex, everybody's done Nclex questions before, right? I need to work on the link, so I will work on the link. So we can skip through these. Next few slides, you know how to access it. We have subcategories right in the module. Okay, I'll show you that when we get down to the modules. I'm not going to do that. Okay, once you score, you can take it as many times as you want, right? But you submit the one you want, the highest score. But if you're submitting me a 30, I'm going to ask you to redo it. You don't have to, but I'm just going to ask you because I think you'll get more learning out of the higher you score, the more you're reading, the more you're looking at rationales. And I think the better you've learned. All right. I need to do 50 questions. Okay. You can't do 225s or 510s. I need one batch of 50 questions. One batch. The reason why we do it in the big picture is because then it covers all the different subcategories. If you start doing 225s or 510s, it really limits the topics that we cover. You guys know that we don't, I know you know this by this point, that we don't accept screenshots, right? And the other reason why it's important to let me know if you're a repeat student is we have to reset all the work, because it already has you in the system as turning in things. So we have to reset that for you. Okay. Case studies. You guys know how to, they're right in the module, right? You guys know how to access case studies, right? All your work from this class and every class, frankly, has to be started within your module. The link in the module, that's how you start it. You don't go outside and go into Evolve and go that way to get into assignment in the module. It's not going to work. And you're going to end up sending me a screenshot and it's not going to work. Okay, so all your work needs to start with the links in the modules. Everything. Here it is. Case studies must be accessed through Canvas course module. Case studies accessed through your Evolve account will not be accepted without prior written approval by the National Dean of Nursing. And that's because it's a real big hassle. Once you just can't go through Evolve. They're not, you might be able to access it in Evolve, but you can't submit it. Okay. With Hesi case studies, don't worry about it. The grades transfer to the grade book automatically. Okay, you don't have to submit it to me. They come in the grade book automatically. Screenshots not accepted. Access by any other method is going to result in a 0. So if you're having to send me a screenshot, then it's already messed up. Writing papers and discussions, you guys know we expect discussions and papers to be in APA format. I've already sent you a link with some APA resources. I'll go through that when we get to the syllabus. Please know the rubrics. Okay, this is how you're graded. This is how I grade. Everybody grades this way. So when you're doing your professional development plan, read the rubric. I already sent it to you in the announcement. Okay. Taking exams and quizzes. There's no quizzes. You guys all know how to set up for exams. What's the first thing you do during the exam if you're having problems? Stop. Right? Stop and contact me. Okay. And we'll problem solve. Okay. I can't do anything, bottom bullet, I can't do anything if you, I can't allow you to retake the exam due to technical problems or other physical or emotional issues when the majority of all the questions have been answered, right? Or you've run out of time. That's not the time. I can't help you there. Okay. Kaplan, we're not going to deal with today. It's not till week 10 or 11. We'll deal with it then. Hesi, we'll go through these last couple of slides when we're preparing for Hesi. So I'm not going through those now. Okay, so that's your PowerPoint. Sorry if a lot of that was repeat. Can you guys, who has any questions up to this point? Nobody? Okay, let's go and do our, oh, I don't want to end the meeting. You guys probably want me to, but let's see. Share screen. I did ask you guys to put your campus and your names in chat, right? Okay. All right, let's go find what else I wanted to do. I wanted to do, oh, I wanted to pull up our Monday 8 to 10. Okay, here we go. All right, so this is what I see. So I like to go through what you guys see. So I'd like to go into the student view. No, well, I will in a minute. Let me just go through announcements. So everybody, my understanding is everybody has access to announcements. Okay. Welcome message from me. Okay, this is where your PowerPoint is that I'm going through right now. So if you have any questions or you want to review the Kaplan or Hesi slides that I skipped for tonight, we'll go through them later in the term. This is your PowerPoint. Okay, so has everybody seen the announcements that I've sent so far? I'm going to stop sharing and take a look. Has everybody seen the announcements that I've been sending? Anybody not having access to them? Does everybody have access to the book, whether it's online or hard copy? Everybody have access to the book. If you don't, let me know. We have to sort that out. Okay, cool. Okay. So I just wanted to make sure you knew that here's the orientation PowerPoint for you guys to have. Syllabus cover sheet. The reason why this has to be submitted with each class. What I wanted you to take away from that is my virtual hours. Okay, so I want to be clear. I have to put down virtual hours on the syllabus cover sheet. To be consistent, I always do an hour before class. Okay, so it would be 7 o'clock. Okay, I don't get online at 7 o'clock unless you guys have let me know you want to schedule a time to meet. My point is, I can meet with you guys anytime. You don't have to wait for if something comes up Tuesday or Wednesday. You don't have to wait till the following Monday. Just shoot me an email that you want to get on Zoom for 5 minutes. You got to talk to me about something or call me on the phone. Okay. So yes, I have to establish an office hour, which is the hour before class, but know that I'm available all the other times too. I'm usually pretty flexible. I can set up a Zoom pretty quickly. Make sense? So that's a syllabus cover sheet. I really do want you to read that, although you should be practicing all of this. And this is from Dr. Lundy, who is our course lead. She gives you a welcome, and then she talks about etiquette. Okay, you should already be doing all this, right? So read through that one. And then I meant to send these on week 2, but they kind of went out early. So that's my problem. And I'm talking about the math resources, these 3 up here. Math resources, APA resources, math dosing calculations. I've sent these out to my students at the beginning of the term, usually in week 2. You don't have to go look at them now, but know that they're there. And over the next couple of weeks, I would start looking at them before the first term if you need some help with math, if you need a refresher in APA. Okay. And the other thing I'll send out in a couple of weeks is I have found a really good group of testing tutorials from Elsevier. Test taking skills, critical thinking, how to break down a question, how to eliminate answers, how to really good. It's about, I think, 8 or 9 different little tutorials, and they're not long. But I've been sending these out for the last 3 or 4 terms of my students. I've loved it. And I send them out early and earlier. I used to send them out right before the Hesi, but then I heard from students that, God, it would have been so helpful to have this at the beginning of class. So I'll send them out. Okay. So I try and send out as many resources as I can to help you guys. Okie dokie. You guys got your welcome message from Dean Brown. right? Everybody get their welcome message from Dean Brown? Excellent, excellent email. Okay, she gives you a lot of testimonials from previous students about the class. So have a look at that if you haven't seen that. And then I will send you out every week. It will say week 1 announcement, week 2 announcement, week 3 announcement. And it goes through exactly what I did, which is what we're going to be covering. Okay, I try and go through, it's really a summary of the module. It's not anything additional to the module. Homework, what do we got going this week? What are we doing? Your professional development plan is due Sunday. Follow the rubric. Look at the guidelines posted. Okay, attached to the assignment guidelines. Okay, I mean, yeah, I want you to look at them in the module, but there's another place for them too. Okay, and so this is your professional development overview and what you need to do. Ooh, is this looking like this?
Yeah,
in all
mine
yours?
did that as well.
Okay,
I had to download it.
okay, so you can go into your module and get that, right? Everybody knows how to do that. It'll be in week 1. As you skip through, well, you just click on the link. Okay. Ooh, okay. I'm not liking that. And then you can get on this, right? The template. I'm just trying to make it a little bit easier for you. I sent you a template because we looked at the rubric and said, what does the rubric want you to do? The rubric wants you to list your goals. What are your short-term? What are your long-term? What's your plan of action to achieve your long-term, short-term goals? And what's your current position? What do you do? Current position experience, current position skills. What are your strengths and weaknesses? That's what the rubric states. So I just kind of made a little template for you to make it easy. Does that help? If you want to use it, fine. If you don't want to use it, fine. Just make sure if you don't use it, you make sure you have everything in there. Okay. I need to do a poll here. Since this is orientation, I'm going to stop share. Since this is orientation week, last term, my groups opted to cover week 1 material in week 2. So the first hour of next week was week 1 material. The second hour is week 2. This morning when I posed that, or the other option is a recording. My group early this afternoon wanted a recording. Okay, they want a recording of week 1, chapters 1, 2, 3, and 21. Do you guys care? What do you guys want? You guys want to cover it all next week, or you want a recording?
Recording.
Okay. Anybody else have any? So it means there's two additional hours I'll have to watch this week. Okay. So I'll do a recording. I'll send it out to everybody. Okay. I'm probably not going to get that probably till Wednesday. I want to get through class tomorrow, and then I've got a bunch.
Have the PowerPoint.
What?
Can I just have the PowerPoint? Are you
PowerPoint?
going to lecture over a PowerPoint?
Am I going to lecture over PowerPoint?
Yeah.
No, I do more than covering a PowerPoint. I don't understand your question.
It's okay. I'll watch your recording.
Oh, I see. Yeah, I see what you're saying. It's up to you. You know what? I'm going to provide you guys the recording. I'd like for you to watch it to cover week 1 material, but that's up to you. I teach partly with the PowerPoints. I teach partly from the book, and I teach and we review case studies. So that's up to you. Okay. Let's see, what other announcements have I sent? I will combine this with your week. There was so much information that this was a separate one, but usually it will say week 1 announcements, and I'll send you the PowerPoints and I'll send you the case studies. Okay. I really like the case studies because they have rationales. Okay. So, and I really like for you to try and have a look at what we're going to cover over the weekend. So on Monday nights when I say, hey, do you guys know what chapters or topics we're going to cover? You know, it's nice that you have a little bit of an idea of what we're going to cover. Okay. Everything's connected in this class. Okay. The PowerPoints are a summary of the chapter in the book. Okay. And then the case studies are reflective of what the chapter covers. So in the school nursing chapter, the case studies about a school nurse scenario. Okay, what I like about the case studies is the faculty develops the exams 1, 2, and 3, and then we have nothing to do with the Hesi. That is, it's like Nclex. But we use case studies in developing our questions as well. Okay, because the case studies have excellent rationales, and they're excellent, in my opinion, learning tools. So we develop our exams from the PowerPoints, which are a reflection, which is an outline of the chapter, as well as the case studies. So that's why I send you case studies. And if we have time in class, we'll go over the case studies as a group. Okay, makes sense? Okay, is that it? And then I just asked you to acknowledge that you're receiving all the announcements. So that's it for all the announcements. Let's go into the syllabus real quick. I'm going to go into student view because I want to see what you guys see. Okay, so I'm in your student view. I like to look from a student view from what you guys are seeing. So let's download the syllabus. Anybody taking a look at the syllabus yet? Okay, I'm just going to read this top paragraph. This course introduces community nursing, community health nursing. We focus on historical development, philosophy, healthcare systems, epidemiology, and specific target groups. What we mean by that is specific vulnerable populations. You're going to learn about primary, secondary, and tertiary prevention activities. We emphasize that as they relate to individuals, families, groups, and aggregates within the community, right? We're going to talk about transcultural, anthropological nursing concepts, as well as rural and home health delivery. Okay, all the diverse roles of the community health nurse are explored. So I just want to take you down real quick to the weeks and show you. I asked you at the beginning, what do you guys think community nursing is all about? Well, here's the things we're going to be covering. And it's not, we're not going to need to know every chapter start to finish. Okay, there's a few concepts that we bring out of each chapter. Okay, and that's what I'm going to teach. Okay, we're not going to teach every chapter of the whole book. Okay, there's a few important concepts that will come out of each chapter. Okay. So we're going to be talking about community-based nursing, history of public health nursing, healthcare systems. What do you think are vulnerable populations in the community setting? What do you guys think?
The elderly.
Who else?
kids.
Pregnant teen,
The homeless.
homeless, HIV, TB. What about addictions? Okay, so we're going to study vulnerable populations. Week 2, we're going to cover the school nurse, healthcare issues in the communities, which are many because we're working with clients across the whole lifespan. Okay. What are family health risks? We have to be able to do family health assessments and identify risks. Okay, what are common childhood ailments, safety concerns? This is in week 2, and this is what your discussion question is. We give you several common childhood ailments to pick. We ask you to pick 3 and talk about signs and symptoms, talk about consequences, talk about a 6-point plan to talk to parents about. Might include lice. There's several, there's like 6 of them to choose from, but you'll do that in week 2. And again, every week has a case study. So in week 2, the case study I sent you is about the school nurse. In week 1, the case study I've sent you is about the history of public health nursing. Okay. And then we're gonna, week 3, we talk about special populations. There are many in the community, many special populations, right? Poverty, special populations, including poverty, homelessness, mental health, teen pregnancy. Okay, and this is all in your syllabus. I'm just going through it real quick to show you the extent of how many different areas we're going to cover. We talk about home health nursing, hospice nursing, faith community nursing. And in week 4, the case studies about the faith community nurse. And you can see over here on this last column, what's due, right? So if we explore, I always like to go a week ahead just to make sure you guys know what's next week. So let's go back to week 1, turn in your professional development plan. Okay, submit your attestation questions, which we're going to do at the end of the term, or at the end of this class. We'll do it together. Review the website for Healthy People 2030. This is just a summary of your module. All this information is in your module. And then it says, pick a topic you're interested in and explore relevant objectives. So what this last bullet means, and I'll talk about this when we get into the module, is I'm going to be sending out in the next couple of days groups. Okay, I'm going to break you down into groups. Okay, we might have 5 groups, 3 each of you. And then I'm going to assign you a case study, and I'll show you all that in a second when we get to the module. But that's what this means. So you're gonna pick a topic as a group, okay? And then week 2. So that's what's week 1. Week 1 is attestation and professional development plan. Okay. And then you'll be assigned groups and you'll start working on your case studies that are due in week 3. Okay. And here's your link to Healthy People 2030 right here at the bottom here. Okay. And then next week, we have our first discussion question. What do we know? When are initial posts due?
Wednesday.
Wednesday.
And then your peer responses are due when?
By Sunday.
Yep. And then we have our first set of Nclex. So I have to get on the stick and figure out the link. Attestation. Okay. And then prepare for the first test. Okay. And that will be in week 2. That's why it's in week 2, because we have our reviews at the end of the week. Okay. Make sense? So, anyway, I do want to mention week 9. Okay. Everybody needs to write this down. Okay. We've determined that week 9 is an exam week, which obviously we know, but it's an exam week. So there's 3 chapters that we're supposed to be covering in week 9. Well, we're not going to cover it because we have an exam, but there are questions on the exam that relate to these chapters. So here's one we're going to cover these chapters. So I didn't want to send you chapter 10 ahead of time, because we're going to cover chapter 10 in week 1. Okay. I didn't want to confuse you. Okay. So here's what's going to happen with the 3 week 9 chapters. Okay. Do you have a pen? Chapter 7 is going to get covered in week 6. And this will be, for next term, it will be correct on the syllabus. We couldn't get it changed on the syllabus. We were too late. Okay, so chapter 7 will be in week 6. So when you get the chapter 7, and I'll give you a reminder, in week 6, when you get the email that says, here's your chapter 11 and chapter 12 for week 6, you won't be confused as to why you're also getting chapter 7. Make sense? Okay, chapter 8 is going to be covered in week 7. And chapter 10 is going to be covered in week 1. So when I do my recording, I'm going to be doing 1, 2, 3, 21, and 10. And after class tonight or in the morning, I'm going to probably in the morning after my morning class, so I can send it out to all 3 sections at the same time. I'll be sending you the PowerPoint and the case study for chapter 10. And reminding you that we've added this into week 1. I didn't want to send it ahead because I didn't want to confuse you guys.
I'm sorry, Professor.
Yeah.
Chapter 8 will be covered on week 7?
7.
Okay.
Chapter 10 is week 1.
Okay. Week
Okay.
1? Chapter 10, week 1?
Today.
Oh, okay, okay.
Yeah, it'll be covered this, when I do my recording, I'll add that in there. So week 1 will technically be chapters 1, 2, 3, 21, and then 10. Okay. Questions? And then week 10, we get into, it's all Hesi review. Okay. All right, let's jump into our syllabus, or excuse me, oh, there was one other thing I wanted to cover in the syllabus. We already reviewed this. Okay, this is the grading components. This was in the PowerPoint, but I want to let you know that this was specifically laid out in the syllabus as well. So if you have any questions of what anything is worth, it's all right here. Okay, and then under this is the whole section on grading about the 78. If you don't have 78, homework doesn't get added in. Okay. I've already told you we don't have any quizzes. It's just 3 exams and a Hesi. Okay. You know the Hesi benchmark. The benchmark is 900. I always tell my students I'd like for you to aim for 1200, but we'll talk about that down the road. Okay. Late work. Here's the whole late work policy. Here is the distribution of self-directed learning time. This is how we come up with the 2 credits and the time. Okay, this is what we anticipate it will take you in time to get through this class, which is estimated hours, which are 60 hours, which are worth 2 credits. So for those of you that may think that, wow, seems to be a lot of work for 2 credits. This is an adequate amount of work for 2 credits. Okay, developed by the national curriculum team, not by your faculty. This is by the national standard. Okay, and then we get into the weeks. Okay, so this is really the syllabus down here. If you just have a peek at this every week, pull it up, see what we're going to be covering, what theories we're going to be covering, chapters, what are the readings and what they are. Okay, and then what's due. The third is what's due, but that can also be found hang on, I get out of this and I didn't want to. Oh shoot. Okay. See, I'm not very good techie. So let's go back to Monday. Is that Monday 8 to 10? Yep, there you are. Let's go back to the modules. Okay, so again, I'm going to go to student view. So I want to see what you guys see in the modules. Okay, student resources, you guys should know this back and front by now. There's so many resources in here for you guys. Okay, here's your textbook, foundations book, you know, by semester 7, term 7. Here's a wonderful, I actually use Writing Center resources for students. It's excellent, excellent. You have your library. Everybody should be registered for Next Gen, right? From last term, right? You should all have a login, right? Okay, so here's your, if for the few of you that still haven't done your syllabus quiz, here it is. You can't get any further. And I can't go any further now in the student view because they don't, I'm just in a test student. So I'm going to go back to my screen, but here's your syllabus quiz. Okay, literacy check. Yeah, there's no due date for it. It doesn't affect that you can see the whole module, but just get it done. Okay, I don't want to be chasing you for a 2-minute literacy check if you do it every semester. Just do it. Okay, then there's my information. And I did, at the bottom, I did put contact information. All right, so there's here's my contact information, and there's Dr. Brown's as well. Okay, so I'm going to jump out of here, jump out of student, because I can't go any further. Okay, so getting started, we just went through that. There's your course cafe. Did anybody, there were somebody who put in the course cafe, tell me why you had to put something in the course cafe.
Because you read.
I'm talking
the
about?
Announcement.
You guys know what I'm talking about?
Yeah, to prove that we read the syllabus.
Okay.
The syllabus.
So I didn't hear from a lot of you, but I did hear from probably half. And so this was part of the very first announcement I sent. It was the welcome announcement, welcome 22. At the very bottom, what did it say? To test that you've read this whole announcement, if you could just put in the course cafe, who's in the waiting room? Shoot. If you could just put in the course cafe, what you do to what?
Stay grounded and positive. I think.
Right. So that was just a little test to make sure you're reading through all the announcements. So I did probably have half of you respond. The other half can still respond. It'd be great. I'd love to know what you do. Great ideas. Oh, Alicia, will we be taking a 5 or 10 minute break? I'm just seeing this, Alicia.
No worries.
Coming straight from
Right,
Peds.
you're good.
Oh, I didn't think of that. I should
It's
do that.
okay.
I should do that at the beginning of the class. We're almost done. We're almost done.
It's okay. You're good.
Sorry. And maybe that's something we need to talk about going forward. Do you guys need a 10-minute break? And should we get started at 8:10? I don't know. Well, we should talk about that. As I'm happy to accommodate whatever you guys need. But that is 10 minutes later than we're going to go. Do you know what I mean? Would you
Yeah,
rather?
no, it was
Okay.
okay. Yeah, you're good.
If you guys need to get up and go to the restroom or go get a drink or go do something, just go. Go. Okay. Do whatever you need to do. Okay. I'm not worried about that stuff. I mean, as long as you go and come back in a few minutes, I'm cool with that. Okay. All right. Where was I? Okay. Week 1. So you know what? On the weekends, you guys just plow through this. If you start on, you know this. If you start on 1, it takes you through all of this, right? So it's your overview, what we're going to be learning, what's in the chapters, what's due. You guys know this, what the readings are. Next term, you won't see it, but next term we'll say chapter 10. Okay, so I had to manually do that with you guys. Here's your Healthy People 2030 website. Okay, here's your textbook. Okay, here's your professional development plan. So when we just clicked on that link, right, it said error. Here's what it was. I was just trying to help you out and put it in an announcement as well, but here it is. I mean, technically you're supposed to get it from the module. Sometimes I try and help out too much. So anyway, here's your assignment for the professional development plan. Okay. And here's your rubric. And then our attestation, which we're going to do in a few minutes. Now, I want to take you to week 3, because week 3 has to do with week 1. So when I say, I'm going to send you groups, you're going to work on a group project. Okay. This group project is due in week 3. All right. And so we have the instructions in week 3, like vulnerable populations. We'll talk about it in week 3 or 4, how to get going with it, but you have to go to week 9 when it's due to get the instructions. Does that make sense? So this is called Case Study Healthy People 2030. This is what you guys are this is what your first group project is. Okay. It's not due until week 3, but here's what it is. All right. So you're going to work together in a group. Your group is going to get assigned one of the following 3 case studies that have come from Healthy People 2030. Okay. So I'm going to break you up into groups, 3 or 4 of you. I'll send out a group email. It's going to say, here's case 1, case study 1, case study 2, 3. The purpose is group work. Why is that important? Why should you successfully be able to work in teams, in groups?
Because we're going to work that way when we're actually working as a nurse.
Yeah.
You have to work together.
Yeah, you do. That's exactly right. Thank you. Yep. So there's 2 group projects. One You'll get your groups at the end of this week, or in the next couple of days. You'll have this project that's due in week 3, and then you're going to have a second project that's due in, I think, week 7, in which you guys, and we'll talk about this in a couple of weeks, you guys pick, as a group, pick an infectious disease from, I think it's the CDC website. You pick an infectious disease on their website that you want to investigate. What are the signs and symptoms? What are the causes? What's transmission? And if you want to look ahead in your group, that would be in, I think, week 7. Yeah, group project. Okay, right here. So if you want to look ahead, once you get into your groups and you want to look ahead, that's fine. Okay, so week 1, we just went through professional development plan. Week 2, next week, you're going to have a discussion question. You're going to have an Nclex assignment. We're going to have the attestation. Okay, and here's a little reminder. The instructor will make group assignments for upcoming coursework in week 7 and 9. Okay. And then again, when you want to go back, the instructions for this case study, when I send it out, will be extremely specific. I need everybody to submit, even if you're in a group of 4, everybody has to submit into the discussion post the final result. Okay, it's a Word document. You do it in a Word document and you do it as an attachment. Everybody has to submit. Right? That's the only way you can get graded. And then our exam. Okay. What else? What else do you want to cover? So there's week 1 and week 2. I'm going to be sending out the schedule for the reviews at the end. It's hard to believe where I talked about the reviews at the end of next week, but we already have them scheduled. There's 2 on Friday, 1 on Saturday, 1 on Sunday. Okay, so for next week. All right, I'm going to send you out a recording of week 1, which will include evidence-based practice, which is chapter 10, right? And that way next week we can just cover chapter week 2 information. Okay. And if we get done with week 2 information in a timely manner, then we can jump in and start reviewing for the exam if we want, start reviewing the study guide. Okay. So we're working on, we had some revisions to the exam 1 last term. So we are working on the study guide right now to match up with those revisions. The study guides that we do for this class are a really good representation of what's expected for you to know in the exam. So we do our reviews using the study guides. And what I liked for you guys to have study guides at the beginning of the first week that the exam is going to cover. So for example, exam 1 covers weeks 1 and 2. So I like for you to have the study guide in week 1. Exam 2 covers weeks 4, 5, and 6. So I like for you to have the study guide in week 4, and so on. And there's a method to my madness. One of the things that it's really helpful for students, or I think it's helpful, is, within a couple of days, a day or so of coming to your live review, go back to your study guide and check off, highlight the information we covered. Does that make sense? Because technically, by the end of week 5, I should have covered everything on the study guide that's going to include weeks 3, 4, and 5. Right? Technically, by the end of next week, everything in the study guide is from weeks 1 and 2 I should have covered. So if you go through and just kind of cross-check, right? Cross-check, oh, we covered that today. We covered that today, or this was in the recording that she sent. But let's say you don't understand it. Yeah, I know she covered it, but maybe I wasn't paying attention or went to go drink of water. You can highlight that section of the study guide and go back and do your own research from the book, from the PowerPoint, whatever. But that's why I like you to have the study guide early on for each exam, so you can go through and just cross off. We covered this, we covered this, we covered this. And the next week, we covered this, we covered this. So by the 3rd week, it's done. Everything's covered. Now, to the extent that you understand it, if you don't understand it, we're either going to have to get together, or you're going to go back to the book and reread that chapter, because I don't cover every specific detail of every specific topic. You guys have to do your own work too. But we do overviews of the important concepts coming out of each chapter that we know are expected knowledge that will be on the exam. Does that make sense? Helpful? Not helpful? Is this okay? Is this good information? What are you guys thinking? Throw it out there.
I think it's helpful. I really like the fact that we'll be getting the study guides ahead of time.
Yeah. Of course. And I also like to provide the Hesi study guide at the beginning of the term, because I like for that to be a term-long study guide, to do the same thing. After a couple of weeks, you go into your Hesi study guide. Check off. Yep, we covered that in the first couple of weeks. Check off. We covered that in the third, fourth, fifth week, so that when you come to start studying for the Hesi, the Hesi study guide and community right now, it's 56 pages. Okay, well, you're covering 10 weeks of stuff, but if you pick it up at the end of the term, you're gonna like flip out. It's too big, it's too much knowledge, but technically we've covered it all. Okay, does that make sense? And the other thing we do with Hesi, which is really good, is we don't know the questions that are on the Hesi, but we do an analysis after about the topics that were covered on Hesi. And so when we do our Hesi review, we try and be very specific with you of the topics that were covered. Again, we don't know the questions. We don't pull the questions on Hesi are just like Nclex. They're pulled from a 700 national bank of questions, but we do get what the topics are. And then I will work with you to try and, I don't know, if one of the topics was conjunctivitis, what kind of question might they ask? I don't know. And then we kind of interact and problem solve and come up with what should we know about conjunctivitis? Does that make sense? If we know one of the topics was adolescent injuries, what do we think they're going to ask? I don't know, maybe what's the most common, bike helmets. I don't know, bike helmets. If they're drivers, driver safety. I don't know. That's how we work through. And I actually try and do this in the exams with you guys. I try and kind of tease you a little bit. And when you get the study guide, if you come to a review session, we try, you read a paragraph about what is community nursing. And we try and decide, well, what do you guys think we're going to ask you? What do you guys think? What do you guys think we're going to ask based on the information in this paragraph? What do you think? What do you think you need to know? That's how I like to review. Okay. Is just live scenarios. And I'm telling you guys, the case studies, please review case studies too. They have a lot of great information. I am a stickler for rationales. Anytime you can find an exercise that has rationales to me are excellent learning. Excellent learning. So you've got rationales in the case studies. You have rationales in your Nclex. You have rationales in your, I think your Hesi case studies, your Kaplan. You got rationales all over the place. Rationales are an excellent way to learn. The other thing I have that I like to do weekly is I have a data bank of like practice questions. It's more preparation for Nclex, but if we have time, and I always like to make time to start going through some of those questions, because these are like Nclex based questions, and it shows you how they're formulated, how to break them down. So I like to do that as well. So I like to, I get a lot of tools in my toolbox to help you guys. I don't want to overwhelm you, but yet I'd like to offer you what I have, and you can utilize what you think you need. Okay, this class is not hard. Just do what you need to do and let's move on. Okay, it's not. But if you fall behind and don't do the stuff, you're going to go back to me and say this class is too hard. No, it's not. Nope, it's not. If you stay on track, and you know what, you may need, I don't know, a couple hours the first week to get things done and get things situated, go through the modules, whatever. Maybe by the second week, you need an hour and a half a week or an hour a week or whatever. Just don't blow it off. I'm telling you. Don't. Enjoy. Sit back and enjoy this class. I think it's a nice break. I actually think it's a nice break from what you guys, from your big, huge med surge and then your clinicals and your peds and your clinicals. So, okay, let's everybody go to week 1 attestation. Let's go there. I'm not going there because I know what the questions are. I think I know what the questions are. First question, I think, is what's the late policy? So who wants to blurt out what the late policy is? What's the first thing? First thing, prior approval, right? Second thing, what's the second thing? For late, days 1 through 7.
1 through 7 is like minus 10%.
Correct. And that's assuming there's prior approval, right? But hopefully nobody's going to go there, okay? Unless there's a true emergency, just get it turned in. Let's not even go there. Okay. And then after day 7, what happens?
You got a 0.
Okay. And second question, what's primary care? What's primary care? Or primary, when you go for a primary care visit, what is it? Education, prevention, it's primary care. You're going to learn about primary, secondary, and tertiary in this class. I'm not going to go through it tonight, but primary care, primary prevention is all about education, prevention. So that's all we need to know about primary care for right now. There's a really lengthy definition in your book about what primary care is. And if we didn't cover attestation in class, like we hadn't before last semester, the responses I got for attestation were, like paragraphs, because that's what was in the book. But that's what we need to know. Primary care. Think about going for primary care visits, taking kids in for well child visits, right? It's all about education, prevention of illnesses, disease. Okay. So when you're done with that, hit submit. And then you don't have to think about it again. And the other thing to do this week is your professional development plan. Okay. You could sit and start this with the last 15 minutes I'm going to give you. Well, some of you need to go and do that syllabus quiz. All right. Professional development plan, pull up the template, save it as a Word document, and just start typing away. It's what's in your brain. There's nothing to go study from. What are your short-term goals? What are your long-term goals? What do you do? What do you do now? What's your role? What's your job? So I don't know, your professional development plan may take, I don't know, what, 30 minutes to sit down and type all that out? And then you're done for week 1. It's done, over. Make sense? Don't procrastinate, just get it done. And then you don't have community sitting in the back of your head when you're dealing with med surg and peds all week. Community's done. It's out of sight, out of mind. Okay. I mean, I always give the spiel at the beginning, but then I have students that, Sunday night at 11 o'clock, they're, could I just have a few more hours to do my professional development plan? No. Sit and do it tonight. Oh no, you guys are too. Sorry, I didn't say that. Forget I even said that. But just get in there and do it in the next couple of days. And then week 1's over. Well, you'll have to listen to my lecture, but if you want. So anyway, I told you I would get you out a little bit early at 9:44 for you guys. I'm in Colorado, so it's 7:44. Questions. How about this? I'll stay on for questions. If questions come up after, email them to me tomorrow or whatever. Just get in touch with me. I'll stay on if anybody has any questions, but I'm really happy to be here. I feel bad that this is a late night class. I'll try and make it as, what's the word? What am I going to try and make it as tolerable? No, it's not a good word. What's the word? What am I looking for? Anybody?
Painless?
You're gonna make it fun.
Painless.
Painless. I like painless. I like fun.
too.
Yeah. But you guys got to do your part. Okay. Okay. All right. So I am done for the night. Anthony, you have a job to do, right? You know, you have to get switched into this class.
Yes, ma'am. That's the first thing I'm gonna do tomorrow. I'm gonna
Okay,
call
great.
in and see,
All right.
get that fixed.
Awesome. Okay. I'll stay on if anybody has any questions. It was great to meet everybody. Thanks for hanging in there for the first class. You have 15 minutes. That's my gift to you in week 1, the gift of time. Okay, guys, have a good week. Reach out if you need anything. We'll see you next week.
Thank you.
Thank you.
Thank you.
Bye.
All right, Professor.
Bye. Bye. Do you have any questions?
You're still recording. I didn't know if you wanted to stop.
Oh,
recording.
oh, yeah, yeah. Thank you.